So
Suicide is very important, people who are watching it, because this is number 2 cause of a death of a woman in this particular country. It is said that even in men folk, the suicide is pretty common, and especially in down south in Tamil Nadu, the incidence of suicide is pretty high. Why it is so in men over there, we do not know, but I think, Rahul is going to do a justice to a topic of suicide today. Over to Rahul Jain.
Yes, good morning, everyone. Today we shall discuss suicide, and the way we are going to discuss suicide, it's going to be very crisp and clear presentation, and I think everyone's going to like it. Myself, Dr. Rahul Jain, and these lectures are happening under the guidance of Dr. Sharda Jain. So, coming on to suicide. So, recently we have noticed a lot of suicides happening. So, just to mention here that we know about Sushant Singh Rajput. He just did suicide in last 2 weeks. Then there's another girl, 16 years old. She was a TikToker. She did suicide. Then this very famous actor, Heath Ledger, he did suicide. Then Kushal Singh, then he also has a history of suicide. So what I want to highlight is they all had money, they all had fame, they all had basic amenities, they all had everything available. What was the common point which they all suffered? So the common point which they all suffered was depression. So
Correct.
So it's not about the suicide itself. It's about the warning signs and the things we can identify to stop anyone from committing suicide. So what we need to identify that even though like whoever performs suicide, the common among all is usually the depression. The culprit is depression, and the prevention of suicide. Our goal should be to treat the depression and to identify the depression patients early. So coming on to the introduction. So first of all, since we are mentioning the topic of suicide, doing the definition is very important. So definition is very simple. That is, it is an act or an instance of taking one's own life voluntarily and intentionally. And much more typical and much more refined definition is it's an act of fatal outcome deliberately initiated and performed by the person in the knowledge or expectation of its fatal outcome. So one more thing important I just want to mention is that there are two things. One is committing suicide and another is committing suicide successfully. So we have noticed that males commit suicide successfully, but females commit suicide more. So these are the two different things. Then coming to the epidemiology, that is suicide is more than 8 lakh people in the world die by suicide every year. And it is 10th most common cause of death in the whole world. And also it is the most common cause of death among the young people. So this is the one shocking point, that suicide is the most common cause of death among the young people in the population 25 to age of 40. Then
Young people and women also in general.
Yes. Then around 1% every 40 seconds, and in schizophrenics, 10% perform suicide. So in schizophrenic, it's very high. 1 out of every 10 schizophrenic. Then in India, the rate is 10.3 per lakh population. So that's quite high. Then coming on to the causes. So it's not only the depression in such which can cause suicide. It's the depression. It's the schizophrenia, even very high alcohol dependence, borderline personality disorders, and manic patients. So interesting here is why a manic patient who is always happy will commit suicide. A manic patient, this thing, I'm too great, this world doesn't deserve me, and that's why they commit suicide. So and borderline personality disorders are the people who have a very unstable relationships. And whichever relationship they go on to, the relationships are very intense, but then they are very short-lived and they have multiple relationships. So these are the borderline personality disorder people. Then yes, some special entities before we discuss the actual suicide, that what are the other types of suicide. So one is parasuicide. So parasuicide is actually not suicide. It is just harming yourself to gain attention, and there is no intent to die. So people will take knife and they will cut their hands. They'll have some parasite marks on their hands. So then cyber suicide. So there are some people who will make suicide pacts on the internet, and then they will perform suicide. And there's one more example that recently this blue whale game had come in the picture last year, where it used to give there was a Russian game where it used to give some 56 tasks to a child, and then the child will, the last task will be usually suicide. So that is also one variant of cyber suicide. And then there's another entity called as copycat suicide. So this in 2018 there was this case in Sant Nagar in Delhi. There is this 11 members have performed suicide. So what happens there is that one person, the head of the family, will have some psychiatric disorder, and other 9 or 10 people would follow the elderly member, and they will idealize that member, and that member will brainwash the other 10 to do suicide, and all the 11 members will do suicide together. So it usually associated with some religious view that they will go to heaven together or something like that.
Okay.
So copycat suicide, very famous case of Buradi, where 11 people have committed suicide together. Then paradoxical suicide we have already covered even in yesterday also in the case of depression, that when we start the therapy, it's immediately there is a highest risk of committing suicide due to improvement in energy and not improvement in mood. So these are the 4 interesting entities associated with suicide. So I hope they're clear.
Correct.
Then what are the common methods associated? So the most common method is hanging. So hanging through ceiling is the most common method, and the person dies of asphyxiation and strangulation. Then the other methods are poisonings. So organophosphorus is very common among farmers. So we have discussed in toxicology also what is organophosphorus poisoning and what are the common organophosphorus, very common among the farmers. Then there are sleeping pills, paracetamol poisoning.
As in Haryana, the women also resort to pesticides use.
Yes.
Because it's freely available in their houses. To see that the pesticides are चूहों को हटाने के लिए वो उनको चाहिए होता है, और वो they find they use it readily. वहाँ पर जैसे हार्ट हॉस्पिटल है, वैसे पॉइजनिंग हॉस्पिटल बना रखे हैं हरियाणा के अंदर.
Yes, ma'am. And one more thing is availability of the poison. So maybe for those people the availability of pesticides and the accessibility is very easy as compared to a method of hanging and all those things.
Correct.
Coming to firearms, obviously people use guns to kill themselves. Then there is falls and drowning. So the most important is hanging and poisonings, followed by firearms, falls and drowning. And what are the stages of suicide? So when we talk about suicide, first the person will say that he wants to do suicide. Then he will threaten that, okay, I think I should do suicide in near future. Then finally he will attempt the suicide. So what is important is the stage between the ideation and threatening is a stage of intervention. And at this stage, if we apply our intervention, then we can prevent suicide.
Here I want to tell you, as far as the males are concerned, males never speak anything to anybody. They will go and just commit suicide. While a female will minimum talk to 5 people before she commits suicide. So it is very easy to do an intervention in a woman. And that's why we say that we should do an authentic listening, what your friend is talking. And it is good to, have a circle of friends around, because she's going to speak to a circle of friends first. And this particular thing is very important to prevent suicide.
Yes, risk factors for suicide. So this is we have something called as modified sad person scale. So the name is only sad persons, and the full form of these sad persons refers to each and every point. So for these things there are a number of points associated. So first is sex, male, then second age, either young people or elderly people. Both are in risk of suicide, even very young people and even old people also. Then people with history of depression or hopelessness. Yesterday also during depression we have studied a theory of Aaron T. Beck, that is learned hopelessness. There is no future, there is no present, and no one is there to help them. So this gets applied here. So D is depression. and the score, the points assigned with depression are 2. Then there is previous attempts or any psychiatric care in the past. Then excessive alcohol use. Then R is for rational thinking loss. So these people have cognitive distortions. Then if they are separated, divorced, widowed. So in married people, the risk is lower because they have family support. Then there are organized or serious attempts. So if they plan an attempt, then if there is no social support, and if they have told that in their intent that they want to do suicide, then they are at risk of suicide. And if any number is coming to more than 6 or equivalent to 6, then we should get alert and get them psychiatric help immediately. So this is an objective way of saying that someone is at risk of suicide. Modified sad person scale. Then going over to the protective factors. So what are the so these are all about the risk factors and what makes a person prone to suicide. So what are the protective factors? So protective factors are, first of all, joint family. So people living in joint family with strong social support, strong connections with family, who share everything, they are protected of suicide. They're emotionally much more stable. Then married individuals, easy access to mental health care, and a very important point is the cultural belief where their mental health is not a stigma. So people who think that taking psychiatric help is a stigma, they are much at higher risk of performing suicide. And where people who think mental health is just like a physical health and it is not a stigma. So I would just like to highlight one point here. It is just like pneumonia. So suppose a person is asthmatic and he suffers from pneumonia. It is not the person's fault. Just like that, if a person suffers from depression, it is not that person's fault. It is just the instances which caused him or pushed him to depression. So a mental health should never be taken as a stigma. It is just like physical health. But even though it's like a physical health, it's more important than physical health, and still it's being ignored in our country. Then coming on to the objective evidence of suicide. So suicide, basically a brain which is depressed, there is low serotonin. So that's low serotonin, the metabolite is 5-hydroxyindolastic. So it has been seen that there is low levels of this 5-hydroxyindolastic acid in the CSF of these suicide prone patients, and low level of 5-HIAA or 5-hydroxyindolastic acid means there is low serotonin, and low serotonin basically we know that is a cause of depression. So as simple as that. So this is the objective evidence of suicide. Then there are few certain myths we want to clear up when we go on to suicide. So first is, once the person is suicidal, he or she will always remain suicidal. No, it's never like that. So once the person is suicidal, if we get the person help and he gets the person's depression is controlled, the person does not remain suicidal. It is just at the spur of the moment the person is suicidal. If he comes out of that phase, then the person does not remain suicidal. Then some people say talking about suicide is a bad idea. It's never a bad idea. The more awareness people have in society, the lesser it makes mental health a stigma, and it makes the suicide probability lesser. Then most suicides happen without warning. So this point is very interesting. It is never like that. Most of the suicides happen with warning. So people will always try to reach for the help, and if they don't get this help, they will perform suicide. So we should always tell them that they are not alone, and we should support them in their hard times, or they are depressed. We should get them psychiatric help. Then we can prevent suicide. Then some people say people who talk about suicide openly are less likely to do it. It is not like that. Even the people who talk about suicide, as ma'am discussed, that females will talk about their problems before committing suicide. So yes, so that should also be a warning symptom, and we should ask them if they want help, and we should help them getting the help, the psychiatric help. Then yes, so this is one interesting point I wanted to, one interesting slide I wanted to add here, that suppose if we get a call from a person saying that I'm gonna go and do suicide, otherwise you tell me something, otherwise I won't do suicide. So if we don't know how to talk him out of it, then obviously he's gonna do suicide, and obviously we don't know how to deviate his mind to not do suicide. So there is this interesting thing which happens with the suicidal patient, that suicide urges happen in it is like a urge, and that urge only lasts for 10 to 12 minutes. So what we need to know, what we need to do, that we need to divert the patient mind for 10 to 12 minutes, and not to talk about the things which has caused depression in his life for that 10 to 12 minutes. And the moment urge comes down, the patient will only tell that, okay, now I don't feel like that time. The next urge will come after half an hour. So in that half an hour time, we should call a helpline number. So there are multiple helplines. So I found this one helpline, Asra helpline, which is 24/7 open. So there is this number. This number can be called, and the patient's call can be transferred, and they can talk. They know they are professionals, and they will talk the patient out of suicide ultimately. So this is one interesting strategy, that if someone calls you at the moment and say that I'm going to do suicide, otherwise you tell me something, then we should stall them for 10 to 12 minutes, and then during the 10 to 12 minutes the urge will come down, and we have half an hour window till the next urge comes, and then in that time we should transfer the call to a suicide helpline. Multiple suicide helplines available, I've just mentioned one, and then this suicide helpline and then they will talk him out of suicide and get him psychiatric help. And if the patient is not suicidal at the moment, then we can obviously get him psychiatric help next day, or we should take him to a psychiatric hospital, or maybe immediately, and get it admitted and start the treatment. Then coming on to psychiatric management, so in the psychiatric wards, they will treat the psychiatric disorder. So it's not only the depression, it's there are multiple disorders. So we have discussed before also what are the causes. So if the patient is suffering from depression, they will treat the depression. If the patient is suffering from mania, they'll treat the mania. If the patient is suffering from borderline personality disorder, they will treat the borderline personality disorder. They'll manage it. Then if the patient is suffering from schizophrenia, they'll treat the schizophrenia. So in schizophrenia, the suicide is usually due to first command hallucinations. So what happens is, schizophrenic patients, the most common symptom is auditory hallucinations. So they'll be hearing some multiple voices telling them that go perform suicide, go do suicide. So once we control these voices, they're less likely to do suicide. So treating the psychiatric disorder is goal-oriented therapy. So first is we need to control the whatever is the precipitating factor related to that suicide. Then electroconvulsive therapy is very useful. Then yes, this cognitive behavioral therapy is again a very useful tool, and it's a psychological therapy where we treat the cognitive distortions. So I've just added few examples of what cognitive distortions are there, and even some of us, the normal people who don't have any psychiatric disorder, might have these distortions also. So they are not right, and they push the patients to going towards the depression and mental disorders. So some examples are overgeneralization. So these people will consider one failure as they will overgeneralize it. So suppose a student of 12th class failed in 12th class exams. So it is okay. It is not something. So he will think that, okay, I have failed my 12th class, so I am a failure in my life. I do not deserve to do anything else. He might be a wonderful cricketer. He might be a wonderful musician. But then since he failed in 12th class, he will overgeneralize it, and he will think that my whole life is a failure. So that is one type of cognitive distortion. Then selective abstraction. So suppose a teacher is there. Teacher is a wonderful teacher. The teacher is teaching 100 students, and one of the students come and tells that, sir, you're not teaching nicely, and he generalizes, and he just selectively abstractize that, okay, this student has told me I'm teaching bad, so which means I'm teaching bad. He is not considering 99 students telling him that, sir, you're teaching wonderfully. So that is also one example of cognitive distortion. Then arbitrary inference. So some people will say, okay, when they're going for work, they saw a black cat, so their day is going to go bad. Correct. So that is one example of arbitrary inference. And there is one more cognitive distortion, like all or none phenomena. Then people will think that only good things can happen and only bad things can happen. So that is also one example of cognitive distortion. Then family therapy and group therapy is also part of psychiatric management, and we should enroll them so that long-term management will be happen under family therapy and group therapy. Ultimately, family therapy and group therapy, it's like protective factors. So we know that joint family and the family where there's strong social support, people are less likely to go for resort to suicide and measures like that. So enrolling them in a family therapy and group therapy, we are trying to maintain their long-term mental health. Then yes, and there's one more.
It's a very popular in outside, this group therapy.
Yes. Then one last point I will just like to add is under cognitive, one more cognitive distortion is intuition. So some people say that, okay, I'm getting some kind of anxiety or some intuition from this person, and this intuition tells me that this person is bad. Even without knowing anything about that person, they think that the person is bad. So that is also one type of cognitive distortion. So in this cognitive behavioral therapy, we try to identify the specific cognitive distortions of the person, and we try to correct them by counseling the person. So yes, this much only about suicide, and I hope it was crisp and clear, and I tried to make it very simple.
Wonderful. It was really great. Very good. Now, Rahul ji,